Hi, Mr. Doe. My name is Morgan Johnson. I'm the speech language pathologist that's going to be working with you throughout your laryngectomy surgery. I just want to start out by kind of explaining to you what my role is in your surgery and care and treatment for your surgery. I will be here before and after your surgery to educate you on anatomy and what changes you might expect from your surgery. We will also discuss some breathing and swallowing and communication options for after your surgery. Let's talk a little bit about your diagnosis. So, you went to an otolaryngologist for a comprehensive laryngeal evaluation, and they did a scope while you were there. You had a complaint of a foreign body sensation in your throat, you had a sore throat and pain when you were swallowing, and a consistent cough. And then results of this evaluation revealed that you had laryngeal squamous cell carcinoma. So this means that there are abnormal cells growing on the structures of your larynx. The larynx plays an important role in breathing, talking, and swallowing. So treatment for this may include surgery, radiation, and chemotherapy. And so you are now scheduled for a total laryngectomy. And your total laryngectomy is a complete removal of your larynx. You just asked me if your surgery would hurt, and I have to say that it does have a recovery time and it's not a super painless process. I think that there are ways your doctor can help you get through the surgery and the recovery as easily and as painless as possible. So this picture here shows what your anatomy looks like before your surgery. So as you can see, this is called your pharynx, and then this part is your larynx. And your larynx includes your vocal folds and your epiglottis, which are very important in speaking and swallowing. And so when you have a total laryngectomy, your vocal folds and your epiglottis are both removed as part of the surgery. And so during that surgery, then the trachea here is redirected and is no longer connected to your nose or mouth. So you typically breathe through your mouth and your nose, and it comes down into your trachea, and that fills your lungs. But now your trachea will be redirected and will no longer come to your mouth and your nose. And then, so after your surgery, they insert a hole in your neck, which is called a stoma, and that is now where the air will flow in through the stoma and to the trachea to fill up your lungs. This hole is a permanent hole, and it's created at the base of the neck and allows air to pass in and out of the lungs. Another change is your anatomy of your esophagus. And so before surgery, your larynx, you had an epiglottis that would come down to protect your airway when you were swallowing food. But now that the airway is redirected and there is no epiglottis there, you do not have that problem anymore. So now when you eat, your food goes in and your esophagus is just one straight shot down to your stomach. And so you no longer have to worry about the separation between your breathing and your swallowing. Do you have any questions so far for me? Okay, I have a little bit more information I'm going to share with you. So let's talk now about some changes you might expect after your surgery. You can expect some breathing changes, maybe some swallowing changes, and definitely some communication changes. And so I'm going to go through each of those changes and what you can expect based on how your surgery affects those things. So changes in breathing. So before your surgery, you breathe through your nose and your mouth. Your mouth and your nose heat and moisturize and filter the air before it reaches your lung. After the laryngectomy, breathing will be done through the stoma. This means your body cannot heat, moisturize, or filter the air that you breathe. Because of this, your body may produce additional mucus to help protect the lungs from the dirt particles, cooler air, and drier air. Many people notice an increased amount of coughing and mucus that is hard to cough out. So I'll work with you and teach you how to suction the mucus if it accumulates around the stoma and it needs to be suctioned out. You also may experience a change in your smell and your taste because there's no longer air passing through your nose, which influences taste and smell. So you might have some changes in the way you taste things and the way you smell things. I want to show you these pictures I have here of some different tubes that you can put on your stoma so that help kind of heat and moisturize and filter the air before it reaches your lungs. There's a bunch of different types of tubes here, and your physician and I can help work with you to determine which one of these tubes might be best or if they're best at all. So this one is a tube that fits on your stoma and can be worn all day, 24/7, and it helps humidify and filter the warm air you breathe. And this can also reduce coughing and reduce mucus production and also help you sleep better. It's really important to keep these things clean, and so we will work with you on how to clean those and take care of them, but there are some options to help prevent the amount of mucus that you might be building up and help humidify and filter the air so that it's a little bit better for you. You also may experience some changes in swallowing. So after your total laryngectomy, swallowing is done typically as you normally do it through your mouth and down your esophagus. However, your esophagus and your air pipe are now completely separated, as we talked about. This means that food can no longer go down the wrong pipe, and so it's just going straight from your mouth down the esophagus, and there's no parts needing to protect your airway. Some people after laryngectomy notice that some foods are harder to swallow and they might need to drink some liquids after swallowing to flush certain foods down. After surgery, you may have a tube that goes in your nose and it gives you nutrition through the tube, and because it goes down straight into your stomach. You might have this for a few days until you're recovered and you're feeling better, and we can do some safe swallows evaluation. So we'll do a clinical evaluation of swallowing, and so we'll do swallowing of liquids, we'll do swallowing of solids, and we'll just make sure that everything you're swallowing is being swallowed safely and efficiently and you're not having any troubles. If our evaluation indicates that you're having some difficulty with swallowing, we would take the necessary steps to modify the consistency of your diet. So we might make changes to the textures of your food. So instead of eating like steak and really hard foods to swallow, you'd eat an easier texture to get down. There are also some swallowing strategies that we might be able to utilize to ensure that you are swallowing safely and effectively. We want to make sure that you're getting the most nutrition and the best nutrition that you can get in a safe and positive way. Another change that you can expect is a change in communication, and this is probably the biggest and hardest change for most of the patients that I see. Because during your surgery they remove your larynx and your vocal cords, this means that you will not be able to produce natural speech the way that you used to produce it, but this does not mean that you won't speak again. There are several options that we're going to talk about for communication after your laryngectomy. These alternate forms of communication are known as alaryngeal speech options, and there are three main ones that I'm going to talk to you about today. The first one is esophageal speech, and esophageal speech is done by taking the air in through your mouth, trapping it in your throat, and then letting it back out. It's kind of like burping, so you'll hold the air in with your tongue, and then you'll let the air out, and the air that flows out of your mouth, it makes the upper part of your esophagus vibrate, and then this can lead to speech. Here's a picture of kind of how that works. So the air, you'll flow the air in, the back of the tongue comes up to compress the air into the esophagus, And then once the air is released, there's a vibration in the esophagus up here in the upper part of the esophagus, and the vibration allows this to move, and so the speech is produced through the vibration of the esophagus rather than the vibration of vocal cords. So I'm going to show you a video of this process, esophageal speech. Here, this man had a tracheostomy and a total laryngectomy, and so he is now using esophageal speech as his main form of communication.
By the end of May, I can make myself understood.
So,
by the end of June, I can talk on the phone, carry on a conversation. The video you're going to see is me acting as a park greeter. It was shot December in 2013. As a park greeter, I meet all newcomers to our park and talk to them about what's going on in the area.
So you can see that he is pulling air in and trapping it, and then as he's letting the air out, kind of in a burp way, he is able to produce speech because his esophagus is vibrating. Let's see, I can show you a little bit more.
Then
See
at
the
a
air
social,
goes in there.
I introduce them all.
And then he comes out, and it seems pretty natural. I mean, the more you practice, the more natural it looks and feels. I want to talk about some of the pros and cons for esophageal speech. Some of the pros are that there's no equipment required, so this is low cost and completely hands-free. And some of the cons are that it takes practice, there's limited access to being able to be taught how to do this, and you may have a slower speaking rate and a lower volume because it's hard to get enough air to produce a faster rate and a higher volume. So that is esophageal speech. Do you have any questions about that? No. Okay, so we will move on and talk about the next form of speech we are going to discuss is electrolaryngeal speech. This is done using an electronic device called an electrolarynx, and this device vibrates when it is turned on. The electrolarynx will be placed flush to the skin on the side of your neck or under your chin. It can also be placed on your cheek. When this device is turned on, the vibration creates an electronic sound source, and then this source can be shaped into speech by moving different parts of the mouth. So, to give you a better idea of what this looks like, I am going to show you a video here. Let me pull it up. So this man also had a total laryngectomy and a tracheostomy, and he uses an electrolarynx as his primary source of communication. So,
tell us about an incident, or could you give us an example of when you're using the little cheater during a call?
When I get on the
so you can see his device there. It's this little device that's handheld. He is holding it up under his chin, and as he moves his lips, tongue, and mouth, you can see that the device is vibrating and allows him to produce speech. So I'll just show you a little bit more of this clip. So he carries this around every day, all day, and he will just place it up to his neck when he is needing to speak. So,
you know, that man for two-way radio man with my little man and down there like this and he's gonna wing it.
So yeah, you can see that he has pretty intelligible
and they
speech.
can understand you.
This certain device takes a lot of practice to learn to use and find the right placement. So sometimes you have to just move it around to figure out where the best placement is. This device is also adjustable, so you can have different volumes. You can do different pitches so that your intonation sounds different. So you can kind of make it your own voice using this device. So that is the electrolarynx, I want to talk about some pros and cons of this device. Some pros are that it's easy to learn, and it requires very low maintenance, and you can use it anywhere, and you learn it pretty quickly. So those are the pros of this device. And then some of the cons, some people don't like the unnatural voice sound that it gives off. Sometimes they say it produces a mechanical sound, so it doesn't sound like a very natural voice. And sometimes it's hard for people to understand that until they get more used to it. It also requires battery and some maintenance to take care of it. The next option for communication we're going to discuss is called tracheoesophageal speech. This is considered the gold standard in voice restoration post-laryngectomy for patients. So this is done once the stoma heals from the surgery. A prosthesis is fitted and inserted into the stoma opening. So here I will show you a picture of what this would look like. So we have here the stoma, and then back here another, this is where the prosthesis is fitted and inserted. It's a puncture made to fit the prosthesis. And then to speak, you would use your thumb here, as shown in this picture, to cover the whole of your stoma, and then force air through the prosthesis into the esophagus. So you would take a breath in through the stoma, cover the stoma, and then air would then be forced up through the esophagus. This would then cause vibration in the esophagus, which would then lead to speech, just like esophageal speech. The air coming up leads to speech, but for this, you're forcing the air instead of through your mouth, bringing it in and holding it and forcing it out. This would be coming through the prosthesis that's inserted into the stoma. And so, yes, the air movement vibrates the walls of the esophagus, and then you can create sound and words normally with your lips, teeth, and tongue. And then this prosthesis also has a one-way valve in it to prevent swallowed food and liquid from entering your stoma. So air would only be able to get through this way, and nothing would be able to enter your trachea through this way, because there's a valve in there that is preventing anything from coming this way through it. So the SOI would fit you for the correct valve and teach you how to use it and care for it. So that is also one of the options. And some of the pros to this is that it produces a good vocal quality and it's easy to learn and you can learn it quickly. Some of the cons are that it requires a lot of maintenance, a lot of cleaning. It's kind of costly depending on your insurance, and you would have to visit me frequently so that we can check on it and make sure that everything is moving smoothly with it all the time. So I'd like to show you another video of how this works so you can see it. This man also had a total laryngectomy and tracheostomy, and his primary way of communicating is through tracheoesophageal speech. So this is his stoma, and the prosthesis is placed there, and so you'll see here that once he begins speaking, he will cover that prosthesis.
My name is Tora, and I have a voice.
And he breathes in, he covers the stoma, and then as he releases air through his mouth, his lips, tongue, and mouth can articulate the words, and so he is producing speech. I'll show you that one more time. That's kind of a short video. So there's his prosthesis. He is covering it.
Hello, my name is Tora, and I have a voice.
Yeah, and so that is his voice, and it also sounds very natural, and he's communicating very well, and you can easily understand what he's saying. There is also a fourth option, and sometimes is an option for the first few moments after your surgery before any of these options are available, and this is nonverbal communication. And so I suggest in your room, your loved ones have a pen and a notebook or a whiteboard and a dry erase marker so that you can write down things that you need in that moment before we introduce any of these communication options to you. So these options can be used shortly after your surgery, but for those first few moments, a pen and a piece of paper might be a good thing to have on hand so that you can communicate pretty quickly after your surgery with your loved ones and your nurses and doctors if there is anything that you need. So now that I've gone over these options, I just want you to know that I will work with you to figure out which of these options is the best option for you. Ultimately, it's your decision which one you feel the most comfortable with, and the one we can work to see which one works best for you. Do you have any questions so far about those options or anything that we've discussed so far? Okay. I see that you're asking if the tracheoesophageal speech requires a lot of maintenance. Yes, this does require a lot of maintenance. It's you'll have to prevent leaking, you'll have to clean it regularly, and I'll talk now about taking care of your laryngectomy and your tracheoesophageal prosthesis now. So there is a process to taking care of your surgery site after your surgery. The skin around the stoma needs to be cleaned twice a day to prevent odor, irritation, and infection. The most important part of stoma care is to make sure that there's no water entering or foreign objects entering the stoma. You need to be very cautious around water because the stoma is on the outside of your neck and it provides a direct path to your lungs. It's harder to prevent water from entering your lungs. So there's some precautions you need to take when you go around water, and you should never be going underwater, and you should be avoiding swimming and taking baths that might cause water to enter your lungs. Here I have some pictures of some things that people use to make sure that they're safe around water. So here is a cover that can go over your neck when you are showering to prevent water from entering your stoma. Here this man is using a form of protection in the swimming pool so that he can prevent water from entering his stoma in the swimming pool. That's probably the hardest part about swimming, is making sure that water does not enter your stoma. There are also some extra precautions you should take for emergency cases when it comes to your taking care of your laryngectomy. CPR is done differently, so it's advised to wear a medical alert bracelet that indicates that you breathe through your neck so that if there is an emergency, people know that you breathe through your stoma, and that CPR needs to be done differently because if they do CPR through your mouth, it is not effective. If your main form of communication is the tracheoesophageal speech, there's also a lot of requirements for making sure that the prosthesis is being regularly maintained. So you'll have to do regular maintenance checks to make sure that there's no leaking, especially making sure there's no liquid going from the esophagus to the trachea. You'll have to do regular cleanings that require a brush and a flush. This technique is necessary to ensure that it is staying clean and nothing is being transferred into your trachea. You'll also need to replace the prosthesis frequently, which requires a visit to the clinic, and the SLP will change out your prosthesis. This does not require anesthesia or anything. It's just an outpatient quick procedure, but you will have to come in to have that done. So that is maintenance that's required for tracheoesophageal speech prosthesis. Now we're going to talk about what you can expect after surgery. So after surgery, you can expect to be in the hospital for several days. You'll have to recover, and you'll have frequent visits from your doctors to check in and ensure you're comfortable, you're healing well, and you're getting enough nutrition. I'll be working with you and come in to do a communication evaluation and make sure that everything is functioning properly for communication. We'll also work on using the communication approach that we decide on, so one of those approaches that we discussed earlier. I'll also be working with you to evaluate your swallowing function so we can ensure a safe swallow. This might not happen the day after or a few days after your surgery. It might be a little while down the road before we test your swallowing, so until then you might be getting your nutrition through a nasal tube that goes directly into your stomach, but then we will work on swallowing function and making sure that everything is working for proper swallowing. And so that is what you can expect from me after your surgery. And we will stay in contact consistently and make sure that you are healing and doing well and everything is working properly for communication and swallowing. I kind of want to talk about some of the social aspects of your surgery and recovery. A lot of the patients I see have some social issues when they're recovering from their surgery, so they experience some depression and some self-image things, and so I want you to know that family support is super important throughout this whole experience. You should advocate for yourself and make sure you reach out to anyone that you have any questions for, your physician, for me. I'm always here to help answer any questions you have regarding any part of your surgery, and we can look into any answers that I don't know of. Do you have a question? Okay. Yes. I see that your question is you're asking if there are any support groups or things you can get in touch with other people who are going through this process to kind of help you get through this, and that there are support groups, and I'll send you home with some resources for support groups. There's support groups that are in person, there's also support groups that are online, and I'll also give you some other resources and guides to help kind of make this a less confusing process. I know that it's a lot of information and it's hard to take in all at once, and it's all happening probably very quickly, and so I just want you to know that there are resources and there are ways to help you kind of get through this process easier. And again, if you have any questions, please feel free to reach out to me and I can help make anything clearer. Are there any questions you have for me now? I think I've given you a lot of information and I know that you have to absorb it, and then we can move forward and discuss further options. And I want you to think over these different communication strategies that I've given you and kind of decide which strategy you feel you might want to approach, and then we will get together and work on using those strategies. I will be there after your surgery to help you through working on those communication strategies and ensuring that you can communicate and safely swallow so that everything is functioning properly and you have the best care. So, do you have any questions for me? Okay, I know that this was a lot of information, so if you have any questions, please feel free to ask me, and I know that you might have some questions down the line, so you can reach out anytime too, and I will help you get through this. So that is all of the information I have for you today. and we will be in touch, and we will work on moving through this process as easily as possible. So thank you for coming in, and please, if you have any questions, just let me know.